And White House spokesperson said this, quote, as her attorney's statement makes abundantly clear, Susan Monarez is not aligned with the president's agenda of making America healthy again. Based on these moves, paired with the new vaccine guidelines that we haven't even gotten into yet, I mean, what do you think that really looks like, their version of making America healthy again? Because you have the CDC director saying that essentially the agency's politicized. You have other resignations, and in those resignations saying we can't move along with the CDC the way it's being run now. In some instances, they feel that it's also politicized. I mean, what do you make of where the administration and where the CDC is exactly going?
I think that it's a particularly dangerous moment for American health and American healthcare. What we're seeing is policy decisions being based not on evidence, not on scientific understanding, but rather an ideological perspective of Secretary Kennedy's that is rooted. If you read one of his books, which was published in 2021, he actually calls into question whether germ theory is real and whether pathogens actually cause disease. And this is the person in charge of public health. And this is at a time when we're facing a large number of health challenges. Climate change is causing more mosquito-borne and tick-based diseases to spread in the United States. We're facing the very real risk that avian flu is able to transfer to human beings and spread that way, which could cause a great deal of catastrophe. We're facing a mutated strain of Mpox, which is spreading faster than previous strains. And although we haven't seen a lot of it in the United States, it is spreading in Africa and is definitely a real concern. So we're facing very real threats from infectious disease. And not to mention chronic diseases, that Secretary Kennedy, because of his ideology, simply isn't equipped to handle and is leading America down a path where we're not going to be able to respond effectively to these concerns. As we saw in Texas, when his response to a measles outbreak was to recommend vitamin A instead of vaccinations.
Is there a